Alright guys, so we'll be continuing with everything. That's the drugs, right? So we'll be looking at the pharmacology of what fentanyl. Pharmacology of fentanyl. Alright. So this fentanyl, we see that is a potent synthetic opioid analgesic. So it's primarily used for what? Pain management. Alright. So let's look at the overview of its pharmacology. So how does it work? It binds to the mu-opioid receptors in the central nervous system. This will now inhibit what? Ascending pain pathways. It will now alter the perception of or your response to pain. You understand? So it has an agonist activity on the kappa and delta what? Opioid receptors. So it's used in pain management. So it's used for acute or chronic pains, including cancer pain or pain that you could feel after surgery. So anesthesia is used for long-term analgesics during induction, maintenance, and recovery from general or regional anesthesia. Breakthrough pain is used for sudden flares of pain in patients that have had what chronic conditions before, right? Fentanyl. So pharmacokinetics absorption is via various routes. It can be given intravenous, can be given intramuscular, can be given transdermal, can be given in the buccal, can be given sublingual, can be given intranasal. Alright. So bioavailability has a high bioavailability depending on the route of administration. For transdermal, you can be expecting things like 92%, then 100% for intravenous. Okay. Distribution is widely throughout the body. Metabolism is in the liver by the enzyme cytochrome 3A4. Excretion is mostly in urine as metabolites, with less than 10% excreted unchanged. Okay. Half-life is 6 minutes for intravenous. Okay. So side effects when taking this fentanyl, it can be experienced like nausea, vomiting, constipation, drowsiness, dizziness, itching. It could also cause respiratory depression, addiction, overdose, or some severe allergic reactions, right? So contraindications, like situations where you shouldn't use it. If the patient has hypersensitivity to fentanyl or any opioids, you don't use it. Then if it is causing respiratory depression, you don't use it on people that have some respiratory conditions like asthma or chronic obstructive pulmonary disease. You understand? All right. So that's it for fentanyl.